Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about something different. I'm going to be talking about this bone. It's called the spine in your body. So we're going to be talking about why is it important to detect scoliosis early. So a very fancy term, but what does it really mean? So have you noticed anybody with a spine that is S-shaped? That means it's a little curved like this, right? You could see it in a child. If you have a child at home, you see that the spine is not straight, it's curved like a C or an S. Now this curve is called a scoliosis. Now this can happen at any age. It can happen in children, babies, we call it congenital scoliosis. It can happen in adolescents. It happens a lot when the child has its growth spurt. In the teenagers, then it's called adolescent scoliosis, and it can be seen in older people. We call it degenerative scoliosis. So any of the age spectrums it can be seen. Now your spine is made up of 33 bones stacked one on top of the other. Now these individual bones, their connection with the other bone is a joint. So there are multiple joints in the spine. Now when the spine is not straight, think about it, the loading is not even on the individual bones. When the loading is not even on individual bones, they age faster, right? And there's arthritis or degeneration that happens. This happens over a period of time. It's lesser of the evils, but it is an evil. The biggest evil, especially in children, etc., is that when it's very curved, your thoracic cage, the cage which houses your lungs and heart, becomes compromised on one side. So the lung may collapse, breathing issues may happen, and it could even be life-threatening at times. So it's very important to recognize it and treat it. If caught early, there are various types of braces and orthosis that you could wear, the child could wear to correct it, because the bones are still a little soft in childhood, and if though they are worn properly, they may correct themselves over a period of time. In certain cases where it's very severe, surgery may be the requirement, where the doctor basically fuses the spine. So he gets them one on top of the other, gets them to stick to each other, puts certain screws called pedicular screws and rods to straighten the spine. All right. This can be done at any age, even done in children when absolutely necessary. And one of the major guiding factors is the pulmonary function test. That is, how is the child able to breathe? So they do a test for the chest to be sure that it's functioning properly. If it's not, it could be an emergency surgery. In older people, it's very important because the height might get stunted, there may be severe back pain, etc. There is a solution to it through a spine surgeon, wherein the spine is fused and made straight. In very minor degrees, physiotherapy may help, because by strengthening the surrounding muscles or paraspinal muscles, they can support the spine better. I hope you enjoyed this video on scoliosis. If you liked my content, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a Hindi channel that's very popular. Please like, subscribe and follow it. Thank you.